The CDC issuing new guidelines today. Fully vaccinated people don't need to wear masks outside. The guidelines come as more than nearly 29% of the people in the U.S. have been fully vaccinated, and more than 42% have received at least one dose. Theocracies are not unique. Yes, the Constitution being a secular document. You are right, Tones, but that's not one of the things that Santorum holds up as what makes this country great. 15 governors so far have let their state orders requiring people to wear face coverings in public expire, according to U.S. News. I think more have done so since this article was written 9 hours ago. I know of multiple cities such as Knoxville who are letting their mask ordinance expire later today. The guidance applies to fully vaccinated individuals, which health officials classify as 2 weeks after the second dose of the Pfizer or Moderna vaccines and 2 weeks after the single-dose Johnson & Johnson vaccine. Vaccinated people can unmask while doing physical activities outdoors alone or with members of your household, like walking, running, hiking, or biking, attending a small outdoor gathering either with fully vaccinated people or a mixture of vaccinated and unvaccinated people. That seems weird. Dining in an outdoor restaurant with friends from multiple households. Current guidelines on vaccinated people indoors and traveling still apply. Yes, but it can be hard to assess every individual's risk for severe COVID-19 in mass public spaces or intimate public settings, the agency says, and asks vaccinated people to wear masks in situations like crowded outdoor events like live performances, parades, or sporting events, indoor spaces like a barber or hair salon, attending a full capacity service at a house of worship, visiting an uncrowded indoor shopping mall or museum. As if shopping malls are ever fucking crowded. President Biden will also mention the guidelines in remarks later on Tuesday, according to CNN. Speaking of Biden in remarks, we're going to hear from the POTUS tomorrow night at 9 p.m. Eastern. So, you know, the Troll Patrol is going to be streaming the Biden joint session of Congress. It will be his first address to a joint session. Of course, we're going to be coming on at our normal time. We'll pick up Biden whenever he starts at around 9 p.m. Eastern. About this time tomorrow night. Brandy Parker McFadden sits in her Vanderbilt hospital bed in Nashville, Tennessee, unable to stand. The mother of three received her second Pfizer COVID shot on April the 16th. Hours later, an unusual sensation started in her legs. Her husband, James, knew something was terribly wrong. James rushed Brandy to the emergency room at Vanderbilt. And then the unimaginable happened. Let's hear from Brandy here.
Second dose of the Pfizer COVID-19 vaccine, she was unable to move from the neck down. As News 2's Alex Dennis shows us, she is encouraging others to advocate for their health.
It's just like the worst nightmare I can ever imagine.
Brandy Parker McFadden.
I am encouraging everyone and advocating for their health that you should get vaccinated.
Is confined to her hospital bed at Vanderbilt.
Can you walk right now?
No, I can't walk.
Less than
This might have nothing to do with that shot. It could be a freak occurrence. It does have something to do with that shot.
From her shoulders down.
I thought maybe if anything, I'd probably get like flu-like symptoms because I'd already had COVID, but I never in a million years thought I would never be able
to
go to the bathroom.
The fact that she already had COVID, it could be something with the long COVID. Oh, I have been thinking, should I look up the TV station and find out if it's a Sinclair station. I would almost assume that it is. Well, that's the reason I wanted to play it. Be like, there could be a million reasons why a hyperactive immune response. It could be a lot of things. So, as I said, it could have nothing to do with the shot. It could be a freak occurrence having to do with the shot. One in fucking millions of people might have some freak occurrence. It could be a combination of things.
Room or get up and
Could be contaminations in that particular place. You're right.
stand up and hug my kids.
The usually active mother of 3 is speaking out, not with the intent of causing fear.
I'm not saying don't get your vaccine. I'm just saying that COVID is really real.
And still really new, she continues, including the vaccine, which is why she feels any possible adverse side effect should be investigated, even if it is extremely rare.
There's been, I don't know how many people have been vaccinated and been fine, right? But we have to tell everything, otherwise
Over 200 million now.
thing of COVID.
Brandy advocates for women's health on a daily basis. Following a diagnosis of epilepsy, she created a nonprofit called My Epilepsy Story. Now her fight has shifted from her hospital room, warning of other women with similar symptoms to hers.
We do know there's been a couple of cases, a couple other women, but those women did not.
Did she have epilepsy after the shot? She created a website while she was paralyzed in the hospital? Or she had epilepsy before? And this could have something to do with the epilepsy, but if she's had like some sort of onset epilepsy episodes, there could be something more going on with this woman. I hope she gets the care that she needs. Vanderbilt is an extremely good hospital, so hopefully you are receiving magnificent care, ma'am.
Have epilepsy.
She applauds the investigation into the Johnson & Johnson vaccine, which involved 6 women and rare blood clots, and she's hoping research will be done into these cases of paralysis.
This is why I say we need government funding and NIH for all these things.
Her husband James is also encouraging anyone with rare reactions to speak up.
Well, hell yeah, she's on the right side.
Affecting our family and us, but this is bigger than us.
In the meantime, Brandy is focused on the positive.
I have gotten some movement in my toes, which is
She's
great.
on. She's for Medicare for all apparently.
This week, Alex Dennis, News 2.
We reached out to Pfizer. The company spoke to us by phone. They said they are closely monitoring side effects.
Yeah, I was not expecting her to come to that conclusion.
To date, more than 200 million people around the world have been vaccinated with our...
Yeah.
It is important to note that serious adverse events that are unrelated to the vaccine are unfortunately likely to occur at a similar rate as they would in the general population.
I'm with you, Merkin. That's where I thought it was going. And she's like, oh, this shows why we need a national healthcare system. Bravo! You are correct. And why we need to take things like vaccines out of corporations' hands. 15 Oregon counties move into extreme risk category. Now, we looked at a map the other day of where COVID was accelerating, and the Northwest was one of the areas. Also in Michigan. The rest of the country seemed to level out, but there were pockets of it that were accelerating. I wonder if that is because of variants. One of the first places we found cases of the original COVID-19 was in Washington. Governor Brown announced Tuesday that due to the rapid spread of COVID-19 in Oregon, 15 counties will move to the extreme risk level effective Friday. The Portland area that includes Clackamas and Multnomah counties. I'm sorry if I fucked those counties up. Sorry. In addition, 9 counties will be in the high risk level, 4 at moderate risk. The governor also announced that outdoor capacity limits for bars, restaurants, and other sectors will be raised from 50 to 100 people in extreme risk counties. That's cool that they're closing down indoor dining but opening up more outdoor dining, which is cool now that things are warm. Oregon pronounces things wrong anyway. Cool. Awesome. Governor Brown's office says she is also partnering with lawmakers to approve a $20 million small business emergency relief package to immediately support impacted businesses in extreme risk counties. So good on her. Meanwhile, across the nation, we got some dumb fucks running a school. This is a private school in Florida. Says they won't employ vaccinated teachers. This from the Miami Associated Press. A private school founded by an anti-vaccination activist in South Florida has warned teachers and staff against taking the COVID-19 vaccine, saying it will not employ anyone who has received the shot. The Sitner Academy in Miami sent a notice to parents on Monday informing them of a new policy for its 2 campuses of about 300 students from pre-kindergarten through 8th grade. Teachers or staff who have already taken the vaccine were told to continue reporting to school, but to stay separated from students. Sitner stood by the decision Tuesday in a statement sent to the Associated Press, which featured the biologically impossible claim that unvaccinated women have experienced miscarriages and other reproductive problems just by standing in proximity to vaccinated people. Holy shit! Oh, that was great.
Do you think we're stupid? You think we're fools?
If I was an employee there, that is the last place I would want to be, unvaccinated. Fuck. Remember a few weeks ago, we reported about a concert. They did a test concert in Spain. No sign of infection after test concert. 6 people tested positive within 14 days of attending the gig in Barcelona, but the incidence was lower than that seen in the general population. Around 5,000 music fans took part in the experiment after testing negative for COVID-19. Revelers wore masks but did not have to socially distance. Of the 6 people who tested positive, researchers concluded that 4 of them were infected elsewhere, not at the event itself. Spanish authorities let the show featuring the band Love of Lesbian go ahead as part of a research project. The rate of infection among attendees was half the rate of the people of the same age in Barcelona. There is no sign that suggests transmission took place during the event. Infectious disease specialist Josep Maria Libre told a news conference on Tuesday. The band involved in the experiment, Love of Lesbian, thanked the event's organizers and scientific advisors. A similar 2-day experiment took place in the Netherlands in March with around 1,500 people. So there you go. I believe there were 50,000 people in New Zealand over the weekend in one of the largest public gatherings since the coronavirus pandemic began.